Hi, my name is Selena Wildeman, and I'm a physical therapy student at Campbell University. Today I'll be demonstrating a strain counterstrain technique for the posterior ribs. This technique uses passive positions, placing a patient into a position of greatest comfort and relaxation to effect a change in an area of dysfunction in the body. The technique utilizes specific passive positions for various tender points in the body and relieves pain by reducing an inappropriate proprioceptor activity in the muscles that are the cause of the pain and discomfort. Now, this tender point that I'm looking for is different than a trigger point. Trigger points radiate pain when compressed, and tender points are more localized edematous tissue that are indicative of somatic dysfunction. So I'll first locate a tender point. In this demonstration, it will be on the fourth rib. So I'm going to have my patient, Kelsey, come over here, and I'm going to show you how to locate the tender points. So to locate the tender point for posterior ribs, the patient will be in sitting, and the PT will be behind them. The first thing to do is to get the scapula out of the way so that the PT can adequately palpate the ribs. So this is done by bringing the arm across the front of their body to hold on to the other shoulder, and I will hold it here so that Kelsey relaxes the muscles on this side of the shoulder in order to help me find the tender point. So to start, I'll first find rib 2 and press into the superior aspect, pushing downwards just enough to blanch my fingernail. So I'll find rib 2. There's 2. And then at this point, when assessing for a tender point, I'm feeling for that thick edematous tissue that's indicative of dysfunction. And I will ask the patient if they feel any tenderness or pain at the area that I'm pressing. So I'll first, like I said, find rib 2, and then continue down to rib 3 and press down the same way, and then to rib 4, and to rib 5. And that's how to assess for a tender point. Now that the tender point at posterior rib 4 has been located, I'm going to demonstrate the treatment position for that specific point. For treatment, the patient is in sitting, and if the patient's tender point is on the left side, I will place my leg up onto the table, onto that side, and have Kelsey rest her arm over my thigh with a pillow over my leg. So I'll take her up. I will passively put her arm up here. Now the opposite arm is placed behind her body to relax it. And the patient's feet should also be up on a stool on the side opposite the tender point to enhance relaxation of the body. So her feet are placed on a stool over towards the right side. So I will then passively bring the patient towards this left side, maintaining control, and I will then rotate Kelsey away, bringing her right side back towards me. So she's side bent to the left and rotating back to the right. I'll then ask Kelsey to take a deep breath in, and as she breathes out, I'll pull the patient into more rotation to the right and full relaxation, and I'll palpate the rib on the left side to find the mobile point, which is the point in motion where the tissue relaxes and lets go, and the patient should report significantly reduced tenderness at that point, which is, again, the same tender point that we found earlier. So then I'll monitor this point with very light touch and no pressure on the point in order to avoid giving too much input to the tissue. So again, this is just a light pressure, enough to just blanch my fingernail. So the physical therapist will hold the patient in this position and monitor the mobile point for a full 90 seconds. So when that 90 seconds is up, I'll hold her steady as she takes her feet off the stool, and I will passively return her slowly back into the neutral position. And this is completely passively so that we do not stimulate the muscle fibers that we just treated. So I'll bring her back up, and I will passively lay our arms back where they were. Okay. I will then recheck the tender point by doing the same thing that we described earlier, by pushing just enough to blanch my fingernail onto the tender point. And for the treatment to be effective, the patient should report 70% improvement in pain and tenderness at that point. What do you feel, Kelsey?
It'll be good.
70% improved?
Yes.
All right, we were successful. If the patient still feels tenderness and pain, then the physical therapist most likely did not treat the hottest point. So therefore, I would reassess for tender points and repeat the treatment. So now I'm going to perform the treatment as I would with a patient in the clinic. So Kelsey, I understand that you've been having some just diffuse pain in your upper back.
Mm-hmm.
I'm going to try a technique that may help you out.
Okay.
So I'm just going to feel around in your upper back. Is that okay?
Yeah, it's fine.
All right, great. Now I'm going to bring your arm up to here, and I'm going to hold it while I feel around. Let me know. I'm assessing for some tender points. So as I press down at certain spots, let me know if you feel any discomfort or pain in any specific place.
Yeah, that one a little bit.
Okay. Not so much down here?
Nope.
Okay, right here?
Mm-hmm.
All right. Okay, so for this treatment, what I'm going to do is I just really want you to relax. I'm going to put you into a position. I want you to relax and just let me move you.
Okay.
Okay? And then we're just going to kind of relax there and hang out for 90 seconds.
Okay.
And then I'll bring you back up and we'll reassess and see if it was effective.
Okay.
All right? Okay. So I'm just going to put my leg right up here. This pillow. I want you to put your feet up on this stool.
Okay.
Over to
To my
side,
right?
to the right side.
Okay.
Yes. Okay, perfect. I'm going to bring your arm up over my leg. Okay. And I want this arm to come back here and relax. And now I'm going to side bend you over here. And rotate this way. Okay, now I want you to breathe in and breathe out. And relax. Okay. I'm just going to stay right here for 90 seconds. Okay, now 90 seconds is up.
Okay.
So I'm going to hold you here while you carefully bring your feet off of the stool. Okay, and I'm going to bring you back up. Don't move back up yourself. Let me move you.
Okay.
Okay. So passively bring you up. Very good. Bring your arm back down. Great. All right. So now I'm going to reassess these points and let me know if it's still just as tender. Okay. Is that spot better?
Mm-hmm.
All right. Would you say that it's 70% better?
Yeah, about 80.
About 80?
Yeah.
All right, great. Then we have an effective treatment. And that video was an explanation of and a demonstration of the strain counterstrain technique for the posterior rib 4. Thank you very much.